I'm Brittany Lewis with Forbes Breaking News. The House Oversight Committee held a hearing Monday on the federal response to the opioid crisis. During the hearing, Dr. Gupta, the director of the White House Office of National Drug Control Policy, outlined what steps the Biden administration is taking to combat the opioid epidemic. Dr. Gupta said that the Biden administration has made a, quote, unprecedented investment to expand prevention, treatment, and recovery services. Here's more from Dr. Gupta.
The gentleman yields back. I now recognize myself for 5 minutes for questions. Thank you very much, Director Gupta, for coming before the committee today and for your leadership. And thank you for your tireless commitment to ending the overdose crisis, which has devastated so many families in our country. I know that this has been a top priority of the Biden-Harris administration since day one. Director Gupta, in addition to issuing this year's National Drug Control Strategy, what progress has the administration made so far in expanding access to services and care to prevent overdoses and treat addiction?
Thank you, Madam Chairwoman. We have had significant progress made. In fact, that now there are telehealth provisions that allow providers to treat addiction across the country, especially in rural areas, underserved communities, and behind the walls. Telehealth, including phone consultation, is a crucial aspect of expanding treatment. We know that less than 1 out of 10 people today are getting the treatment that they need. We've also allowed, DEA has mobile vans for methadone as well as take-home methadone. These aspects are helping us improve and expand treatment at a time when oftentimes people are dying without treatment. We're also making efforts to make sure that everyone can get naloxone, which is the antidote for opioid overdose reversal, which 3 out of 4, almost 80,000 people are dying because of the lack of naloxone. At the same time, we're allowing more and more physicians and providers, others, to be able to write prescriptions through practice guideline changes so that they're able to get more treatment across. So our goal of treating untreated addiction, creating the infrastructure. The American Rescue Plan has invested $4 billion, unprecedented amounts, and the president has now called for an increase in $3.2 billion. At 75 cents on the dollar of that increase of the $42 billion drug control budget goes towards making sure we're expanding treatment, we're expanding prevention, we're expanding recovery services.
The coronavirus pandemic strained every aspect of the American healthcare system, with a disproportionate burden falling on people with addiction and the providers who treat them. One way the federal government responded to this crisis was by promoting the use of telehealth to increase American access to addiction treatment. Dr. Gupta, does the administration support the continued use of telehealth flexibilities for addiction treatment beyond the coronavirus pandemic? Can you expand on how it is made available to people? How are they made aware that they can have this type of treatment?
Thank you, Chairwoman. It is extremely important for President Biden, for this administration, to ensure that telehealth services are available and are made available beyond the public health emergency. The reason for that is that especially people in rural areas, like my home state of West Virginia, who are often not able to drive, not able to take the effort to get where it needed because of the rurality. These telehealth services allow much more efforts to be provided to people. It's a time where we need to meet people where they are, and telehealth, including phone consultations, allows us to do just that. And same goes for people, especially in communities of color, who already have a difficult time and a delayed time accessing services. This is another service that will help us expand treatment.
Okay, last December, I led nearly 100 of my colleagues on the Democratic side in reintroducing the CARE Act, landmark legislation that would provide $125 billion in new federal funding directly to communities that care providers over 10 years to overcome the overdose crisis. Director Gupta, do you agree that we need to provide sustained, comprehensive investments in treatment and care to communities at the front lines of this crisis as our CARE Act would do? Why or why not?
Thank you, Chairwoman. It is one of the critical aspects of this particular crisis that we provide these types of services to folks, not just for treatment, but beyond treatment, to provide that support, a comprehensive support. So it is important that we think about the ability to get people the help when they need it, where they need it, and efforts like this help us get there quicker and ultimately save lives.
Thank you. I commend the administration for its tireless work to overcome this crisis and reduce the harm it inflicts on our society. And I am a proud partner with you in this work, and you bring invaluable experience to the country from your work in West Virginia. I now call on Representative Norman.
Thank you, Chairman.